both staff and also members of the community who are coming to seek assistance in the hospital are coming in freely, and those who are leaving are also leaving, free of any obstruction. So that is exactly what we expected. Maybe just on that, we just came back from the Helen Joseph Hospital, where the operations are running, but we were unhappy with the fact that the main gate was still having obstruction. The strikers and demonstrators were still obstructing smooth entrance into the main entrance. We spoke to the leadership of the police services. We met the brigadier who's responsible there with also the local station commissioner, and we explained to them the terms of the court order. Unfortunately, they were not familiar, but we familiarized them and also made sure that the CEO leaves them also with a copy. And by the time we left, they promised that they were going to make sure that the court order is implemented, in the sense that making sure that the main entrance is free of any obstruction. We still getting reports here in Gauteng that some of the hospitals are still experiencing some challenges. We will be following up with that, because our responsibility is to make sure that with all the efforts which have been taken, that the court order is fully implemented. We are informed that there's still some challenges in the Val, at Kopanong and Sebokeng, and then in Ekurhuleni at Telemugerane Hospital, there's still some challenges there, and I'm sure the MEC can add a bit more in terms of some of those. And in Soweto, at the Bheki Mlangeni Hospital, that there's still some challenges, and also at the medicines depot, medicine supply depot, that it's also still experiencing some obstruction. I've already spoken about Charlotte. Chris Hani, there has been consistent demonstrations, but outside. So it has not been inhibiting clinical activity inside the hospital. But we just learned earlier on that people were refusing to be dispersed by police at the entrance. It looks like, even though we don't have the full details, police had to use rubber bullets to disperse the crowd. But it's not inside the premises of the hospital, but it was outside. I think it came to the stage where police believed that they were becoming an obstruction to staff and members of the community to enter the hospital. So I've already spoken about Charlotte and then the Baragwanath. So we have assigned both from the province and from the national department, the DG here and the head of department of Gauteng. We have agreed with the MEC to task them to make sure that senior managers, both from the province and also from our national department, because as a national department, we are also, accommodated by Gauteng. So Gauteng must benefit from our presence here. So we have also deployed our own senior managers to support Gauteng, also seeing that it is a major target of the disruptions. So at this stage, we have a sense that the level of violence and intimidation has scaled down. Many of the hospitals, there's a lot more activity, more staff are coming in. So we will be following up on the ones which I've mentioned, where there seem to be still some obstruction. But remembering also that this labor action is not only in Gauteng. I did mention yesterday that the highly affected provinces is Gauteng, then the Eastern Cape, those have been quite highly affected, and then KwaZulu-Natal and the Free State, and a bit of Northwest, especially in the Klerksdorp area. So we are working with all the provinces to ensure that services can, be adequate and as soon as possible returned to normal. But we are aware that because of it in the affected provinces, some of the services have to be rescheduled. Non-emergency services have to be rescheduled, but nobody who needs emergency attention should be turned back. Those who have been rescheduled must be given appointments so that they can be attended to speedily. And those who are on chronic medication, they must be assisted to make sure that they don't run out of their chronic medications. And as I said, non-emergency services like non-emergency surgeries can be rescheduled. So besides Gauteng, the Free State also has obtained a court order, KwaZulu-Natal also, Northern Cape, and also the Eastern Cape. In the Eastern Cape, the reports which we have received is that things are much better today. The province also engaged with the union and tried to find some amicable agreements. And the report we're getting today is that the situation is much better. A lot more services are happening. KwaZulu-Natal, in KwaZulu-Natal, also they have increased their security, including procuring more private security over and above the South African Police Service, and this has improved the safety of the staff. In the Free State, also the situation is much calmer today since this morning. There are still some reports of striking staff members trying to disrupt, including quite disturbingly that some of these strikers were even trying to destabilize in one of the ICUs. So we will be following up on this to make sure that this doesn't happen any further. In the Northern Cape, the report indicates that there was more disruption in the outskirts of Kimberley, in the area called Buckley West, moving from the center of Kimberley, from the main hospital in Kimberley, the Robert Sobukwe Hospital, going into targeting now the clinics. So as I conclude, and as from the questions, I'm sure maybe as I conclude, I would ask the MEC maybe just to add a few details, especially with regard to Gauteng. We are coordinating nationwide, working with the heads of departments, with the MECs, to make sure that the situation can be returned to normal as speedily as possible. From our side, we're giving them all the support. We also will be sharing information later today, just to make sure that we have a very coordinated response to this. We again want to appeal to the leadership of Nehawu that while we don't want to interfere with their rights as enshrined in the Constitution, the right to withdraw their services, but this must be done firstly in a manner which respects the fact that health services are essential services. That's one, but also desist from any violence, intimidation, and physical, disruption of activities, and anything which borders on violent activity. And on our part, we will do everything, with the support of our security services, and also everything which is within the law, in terms of making sure that those who engage in such activities must also face the consequences of such. So we're not going to, shy away from our responsibilities in that regard. Thank you very much. Maybe MEC, if you want to add a few things on the Gauteng.
Thanks, Minister, and good morning, colleagues. Minister, I think the issue that maybe it will be of interest to them, which you have touched on, is the issue of contingency measures that we have done, especially in areas where we've been affected as a province. We will definitely make sure that all the appointments that have not been attended to will be rescheduled, especially in areas of operations. So a team is working very closely with the national to ensure that that is done, and we will have a catch-up program in some of the programs that we were supposed to do, because we have been busy with the surgical backlogs in the province, as you have been aware, that we have started. But now, even in that area, we'll definitely make sure that we go back to that program and start to look now into the dates and the arrangements that we've made with some of the hospitals, where we've even, because we've been sharing even some theaters in other hospitals. So we'll make those rearrangements. And some of the patients who are discharged that need to be given enough medication, we will be definitely alleviate that pressure through the health system, because of a process that we do of localizing health. We will go to specific areas where they are and ensure that we distribute the medication so that they don't suffer, especially the chronic patients that we have. And I think on the elective operations, those that have been postponed, they are going to be replaced. I know even here at Charlotte Maxeke, they had to be rescheduled, some of the major operations that were going to be done. So, but now we're going to go back, and then CEOs are working on those plans of making sure that those are being done, Minister. I think other things we have done, but we're working very closely with a team of all the CEOs. We have meetings. We have a command center that we have established immediately. DG's team is part of that command center in terms of advising us of what needs to be done. CEOs reports on hourly basis on what's happening in every hospital, and now we're bringing in the team, as Minister was saying, from the community safety side, so that they become part of the command council, so that they are able to report directly to us, and then we spread the message. And we're hopeful, Minister, with the support that you have given us, as a province in particular, because we're the one that have been hit hard by the strike. Your assistance is helping us. People have positive response. Even the CEOs feel that you are part of us. Through your support, we will definitely achieve this. Even the issue of the medical support, the MSD, which is the medical depot that has been closed, we have measures in place. There is no hospital at the moment that doesn't have medication, because CEOs are working in a clustering manner. Where we have a shortage of linen or medication, they are able to reroute and send the medication where it's needed most. So, Minister, I think those are the things that I wanted to add to the team.
Well, maybe just to also take the opportunity to, appreciate and thank our healthcare workforce all over the country. It was really quite heartening meeting some of them this morning. They were also appreciating the support and the fact that with the improved security, they are able to come to work. So on behalf of all South Africans, I think we should thank our healthcare workforce all over the country for their diligence and their care. Some of them, when they explained, for instance, here, how they had to, take all sorts of risks to make sure that they can come and save lives in the hospital. And we know all over the country there are many other heroes and heroines of our healthcare workers who have done so. Also, just to again, say to our community that we really apologize for the inconvenience to many users of our public health facilities who have been highly inconvenienced by this, and we will continue to do everything within our power to make sure that the situation can return to normality. Thank you very much.
Thank you, Minister. Thank you, colleagues. I think the team from SABC is to arrange. If you have questions for the police, you also direct those questions. They are here. They will be able to. Yeah, I will deal with that later. So we're going to take questions. I'm going to take the first 5 questions, and then from there we'll see whether there are follow-up questions that you would have. This is how we'll run it. Once we have recognized you, then you indicate which house, media house you're coming from, then you post the question, and then you tell us if you want the question is directed to the MEC or the minister or the police or the DG. or the CEO of the hospital. So let me quickly take the first 5 questions. You will follow, and then you will follow.
Minister Angelo Coppola from China Global Television. Has the strike action changed the viewpoint or the positioning of the government or the employer in terms of the wage negotiation offer from what it was to what it might be?
Thank you. Minister Moloto from ENCA. Up to so far, since the strike has started, how many people have died as a result of this particular strike in your facilities? And for that, can you take legal action specifically against Nehawu? But also, in terms of the impact of the strike, if you remove intimidations and the prevention of whatever that is happening, prevention of the workers from coming in, would you say that if the Nehawu members were behaving according to the way you would expect, that they would not intimidate anyone, would you therefore say that their strike is having a negative impact on the services that you are providing? If they were to no longer be violent, do you think you wouldn't really worry much about the fact that they are picketing outside?
Minister Nkosinathi Shazi from Power FM News. Just as a doctor yourself, do you think that health workers affiliated with Nehawu sabotage their public oath just in providing services because hospitals are essential services, or does the end justify the means? Because you did say we do support the strike except the violent parts and intimidation parts. Thank you.
Is that the last? Yeah. Okay. Well, maybe let me start with the last one just to correct you. I don't remember any one of us saying we support the strike. You might have. We said, what I said was that there is a constitutional right for workers to withdraw their labor, but that excludes essential services. The rest of the country's workforce, health workers, firefighters, security services, amongst those which are defined in terms of the labor relations as essential services. Those are prohibited from striking. So that is the overall acknowledgement and recognition of the rights as enshrined in the Constitution with its qualification, because even within the Bill of Rights, it says also that all rights are also having limitations of access to those rights, with particular limitations. In this case, the right to strike has got a limitation in terms of essential services. Maybe just go also straight into Moloko from ENCA. The question as to our own assessment as to whether ordinarily, if there was to be a peaceful demonstration, whether there will be serious impact on the services. Thus far, our indication is that, it's not. This is not thumbsuck. If we're to look at this place where we are, yesterday, services were highly disrupted, and how it happened is that the roads were blocked, staff were prevented, and they were actually turned back to say you can't, the Nehawu members were actually manning an illegal roadblock, preventing people from entering the premises and telling them that they are not allowed. And sitting next to me here, the CEO had to find various ways finally to enter the hospital because she was told that she's not allowed by leaders of Nehawu, having identified herself. And then at some stage, I think they allowed only those who said they were doctors, and they didn't allow nurses to come in. But once we got the court order, but also further engagement with the security services and made sure that the barricades are removed and that no one is tolerated in terms of stopping people and intimidating them from coming in. We have from 7 o'clock, just after 7, when we did our round with the Premier and the MEC, it was clear that the attendance was much, much better. So just from that experience, one will say that the absence of a big number of nurses, especially who were targeted not to come in, was not due to their voluntary support for the strike. That's why many of them are on duty today. So I'm quite certain that, the MEC was at Sebokeng and she reported the same, that, the Nehawu leaders were actually conducting almost like a police roadblock, determining who goes in and who doesn't go in. So that is the kind of disruption which is mostly responsible for the impact on our health services. So with that evidence, the observation is that if those who voluntarily identify with the strike, as we see this morning, I'm sure you also have seen, there are probably about, even when we came in earlier on, when we even greeted them, there were not more than 100 people at the gate. I think even currently, you also have seen, there could be at the maximum 50 to 60 people who have been camping outside the gate. The rest of the people are in the wards, in the casualty, and the fact that staff here, as we interviewed them this morning, many of them said, look, we had to use various ways, even yesterday, to find our way to come and provide the service. So this morning, once it became clear that there was no obstruction, so that is not something we're thumb-sucking. It's very clear that in the absence of intimidation and physical, blocking of people from coming into the hospital, there will be very minimum disruption. We're still doing a reconciliation in the province and nationally in terms of the number of people, but as of this morning, preliminarily, I'm afraid to go into a lot of detail. There was an indication that up to a number of 4 people, are likely to have lost their lives in a manner which can be attributed directly to the strike. We have a legal team which we are consulting to look at what are our options in that regard. So I'm not at liberty at this stage. Our DG, for instance, was consulting with our legal counsel. So sometime later today or tomorrow we'll get legal advice. But we are exploring all avenues. One which we must stress clearly, the principle of no work, no pay will be implemented quite forthright, and we are under very clear instruction from our senior people in government that this time no one, the MEC and her team and all other provinces, they must not entertain the idea of a staggered no work, no pay. If it's withdrawal of services in March, that deduction must happen in the course of March. Those who can be identified in one way or another as having participated in the violence, in the disruption, physical and so on, of disruption, they will face, on the one side, we explore with our legal team criminal charges, but also definitely disciplinary charges will be, will actually, be given to those. So that part we can assure everybody. But we're exploring, because we are, as a government, the people, the ordinary people who use the public service depend on us to make sure that while those who also expressing their rights in terms of withdrawing their services, those who are not essential services, but also those who are essential services in terms of how we deal with that. The public depends on the government to make sure that for their protection, what the law provides must also be implemented in their protection. So that's why we're looking at using every avenue available. As to whether because of the strike there is a change of attitude about the wage, well, that's not within our purview as the health department. This matter, which is a matter of conflict now, it's a broader issue of the entire public service, from the Public Service Bargaining Council. That's where the disagreements are. Health is just one of the departments which are also part of the public service. So we don't determine much in terms of that. That really we left to the Minister of Public Service. I'm under a bit of pressure from my parliamentarians. They want to...
Thank you. I'm going to take 3...
Can I leave the questions to the...
Yeah. We are releasing the minister because he has to attend to parliamentary...
Can I really ask the minister and he has to leave?
The chief is calling.
We are live. Maybe if you can organize the police to answer some of the questions we want to make.
So let's take the additional 3 questions, and then we'll assess whether there's still a need for us to make another set. Yes, and then you will follow.
There's another hand.
4. Start there.
It's Diego Sito from SABC News. This question was really for the minister. I'm not sure now if it's relevant to even ask it. I wanted to find out if, to follow up one of my colleagues who were asking about the wage, if there are talks between government departments, the department, department and himself, given the fluidity of the situation. Now we have likely reports of 4 people dying, and the nature that in South Africa we do have violent strikes that tend to... I think I'll do that again.
Just one question, Dr. Abbas. Talk to my parliamentarians.
Minister, it's Diego Sito from SABC News. I wanted to find out if you are in conversation with your colleagues in government about the future handling of strikes, particularly relating to the Department of Health, given that people obviously die. You talk about unconfirmed reports of the 4 people that have died. Is there an interministerial conversation happening about how wage issues or issues of labor nature can be handled in future, just so that we avoid this kind of things? Are you having those talks at that level?
Well, let me respond, and I hope this time, so that I don't get fired from Parliament. I can also speak to my colleagues there. We have adequate legislation. So there are no specific discussions in terms of that, because what we are guided by is the Labour Relations Act, which makes provision also for essential services. The debate, which I know even the leaders of Nehawu has been saying, is that because all these years the various essential services, which include us, we are of course the most sensitive of the essential services. That the problem is that we have not concluded the service level agreement, which will define to say if the essential workers go on strike, this will be the arrangements. Now, we will reopen those discussions, but from the briefing which I've got from some of my colleagues who have been in this before me, has been that the difficulty of arriving there is that on the one side, Labour want the pound of flesh or agreement, which will have an impact when they do strike. In other words, if you were to say here are 100 essential workers, the Labour will, whenever these discussions come, the Labour's approach is to say we can agree on 10 people remaining and 90 going on strike. From our side, we can only agree to an arrangement which says, let's say for instance, 70 people must be on duty, only 30 can be allowed to be away, so that the service is actually able to run. So those are the things which are conflicting in terms of even arriving at that, but it's not a matter which we're going to avoid. We will be able to get back to that and see if we can be able to find an amicable arrangement. But the bottom line is that in the law, as things stand, it doesn't mean when there is no service level agreement, it doesn't say that the essential workers can withdraw their services. In the absence of that service level agreement, it's illegal for essential workers to go on strike. That's the current in terms of the law. So that's the bottom line.
Thank you. Gatel Sohoto from Kaya FM. I think my question is for you, CEO, just about the operations here at the hospital and how they've been affected. Are you able to quantify or at least outline in detail as to the strike and its effects on certain units? Are there certain units that have had to completely, not be operational, or is it skeleton staff kind of everywhere?
All right, thank you so much, Nkomo-Ralehoko from ENCA. Maybe to the police, listening to the minister last night, he really stopped short of expressing disappointment at the way the police have not acted, especially with regard to intimidations and all that. And again, he's saying this morning that at one hospital here in Johannesburg, there are still striking workers barricading, preventing people from going in. As the police, your mandate is to prevent crime, but also to maintain law and order. Explain to South Africans what went wrong. Why did you fail? Today is day number 4. From day 1, as these intimidations were continuing, the police, in fact, if you listen to a lot of radio stations, people expressing frustration at Bekim Langeni in Soweto. Somebody was saying the hospital is not very far from a police station. Police witnessed all those things. Burning of tires, preventing patients and people from going in, yet the police were there. Explain why the police failed to maintain law and order. But also, seeing that now we are aware of all these disruptions, how far are you in terms of arresting those who are behind us? Maybe if you can introduce yourself as well as you respond.
Thank you.
The last question.
Mine is covered by me. Thank you.
Thank you. Thank you very much. I'm Major General Max Masha, the District Commissioner of Johannesburg. In terms of the cases of intimidation, the case can still be open and people can still be arrested. Yes, we were thinly spread yesterday as the strike was starting, but however, even according to the hospital that the minister spoke about this morning, Helen Joseph, where the court order has already been applied for and is in place, the docket will have to be opened, and then whoever is violating the law will be arrested. So from where we are, we will definitely investigate if there were any lapse from us where we should supposed to have acted. However, the police are always careful not to escalate the strike. So that's why they need to make sure that whenever they act right. And you must also remember, we have the POPs, and even if you remember the Phaahla Commission, where we need to make sure that people with the right equipment are in place so that they can match the level of violence, if any, at that point in time. But if there were any from our side, we'll definitely take action against those. But we will still maintain, like the minister said, that people have a right to strike, but they cannot break the law in the process.
So, Major General, do you accept that you failed the vulnerable people who have no any other option? They can't go to private hospital, police failed to maintain order. Do you accept that you failed as the police in executing your duties?
I don't know to stand here and agree with you, because I don't have all the facts that happened. I'll have to investigate case by case. For example, I'm aware about the Bheki Mlangeni case, because the people who are talking to me, we sent our police there. I was assured that the pops were there. They are allowing everybody. Even we had to put a van there, static, to ensure that there is free access to enter into the hospital.
No, thank you very much. Yesterday, I will start with our casualty. We were unable to receive any patients because ambulances were not allowed to come in. However, we already had a situation where we had our casualty full, with 4 patients who were on ventilators in casualty, and about 26 of them not on ventilators but very sick. The difficulty was that, as you know, when you come in as trauma, you need to have your x-rays done. So the radiographers were not allowed in, and therefore those patients, although the doctors gave them medication and other things, but we were unable to do their radiological examinations. Then I will move to maternity. We had mothers who had to deliver. Unfortunately, as it was said, when you work in theater, you do not need a nurse and a doctor only. You need the operators who must wash the instruments and all other things, the porters to move the patients. I must say that our clinical team who managed to come in became cleaners, they became everything to ensure that at least the emergencies that were there, the mothers who had to deliver managed to deliver through that. However, the elective cases, I'm told it was 61 of them had to be cancelled, and the 4 emergency theatres to try and deal with whoever was already inside in terms of this. So all the emergency scissors elective scissors will have to be rescheduled and put somewhere else, and those patients had to be discharged home because we can't keep them when we didn't know how long it was going to take. We ran 33 theatres, as I say, and so the emergency theatres, with the staff that we had, we could only run 2. I think at night they tried to open the 3rd one. I think it worked towards the early hours of the morning, where they managed to do some of the trauma cases that were in casualty. In terms of the outpatients, we normally see about 1,800 patients in the hospital, of which 1,200 come to about 52 clinics. We saw about 10, if not 15%. The difficulty we had was that these patients were allowed in, but the clerks who must register them and pull their files were not allowed in. And I'm going to what the minister said, is the clerk an essential service. Even if the doctor is here, if he doesn't have the file or the nurse does not have the file, there is absolutely nothing they can do. And so the outpatients who were here had to be given other dates, because how are you going to give them medication? We don't know what they are having. So we took their names and their numbers. However, those who had their scripts or we were able to retrieve their scripts with the few resources, we managed to see them. Of concern was the ones who came for their cancer treatment, and they come from far. And you need pharmacists to mix their medication, but you need the lab people, because for you to give them the medication, you need to first do their blood tests. So the people from the lab were not allowed in, and therefore we can't do the treatment. But the pharmacists who had to mix the medication, even if they knew what was it, they couldn't come in. So again, they also had to be rescheduled. The cancer patients, we've got 2 types. The ones who come for radiation oncology and medical oncology. So the first group is the medical oncology that I was talking, the ones that get medications. The ones that had to get their radiation, the radiation therapists, they were not allowed in, and also it was not possible to treat them. So all of them had to be rescheduled to come on another day. When it went to critical care, we ran about 84 ICU beds. Every ICU, if it had too many people, it was only 2 nurses to do all those patients. Remember, they are all on ventilators. So the interns and the doctors had to become nurses to to do routine procedures that needed to ensure that the patients, and in fact, they said, unfortunately, one of those days, as they say, they had about six resuscitations that they had to do. But fortunately, even the matrons who were trained on that had to jump in and save those patients, and we are very happy that all of them made it. In terms of the general wards, some didn't have anybody, and some had maybe an enrolled nurse assistants. The importance of that is that the nurses have got categories. You cannot give a scheduled drug if it's not within your scope of work. So some of their medication was delayed because if there's no professional nurse to give that medication, it meant that, you know, the matrons had to keep the keys lest you end up with lots of problems. But as people trickled in during the day, I think mostly managed after 12, they sort of like tried to catch up in terms of giving them their medication. The pharmacy, we have patients who just come to collect their medication is about 800. I'm told about 40, 50 are the ones who managed to come in, but they had to wait because the first pharmacists managed to come almost around lunchtime. Remember, the other problem was that because they didn't have their scripts, they couldn't give them, but they tried to give them what was within their scope. And pharmacy, remember, on a daily basis has to supply all the wards with medication. So that could not happen yesterday. So what happened is that each ward had to borrow each other whatever they had. The other difficulty was the food. We had about 850 patients who needed to be fed from morning. And so the only thing we could do, those who managed to come in, they just went in because the whole food service was not allowed to come in. So somebody managed to get the key, and they just took bread and milk and they gave everybody. That's what they had, in Vienna's, whatever they could find to give patients. However, the staff managed to sneak in towards midday, and fortunately the patients, they had dinner. They managed to cook for them. The linen room was also a big problem. And one of the things I was saying, if the linen person is not here, you can imagine if you have 4 sheets, you deliver the mothers, how much blood is there? What are you going to do with the 5th one? So we couldn't get linen anyway. But what we did, we had to rationalize whatever, you know, in the wards where, you know, the linen is, you know, the patient can sleep another 2 days on the same sheet, so that we divert it to maternity, to ICUs, and to casualty. Portering was a big problem also. So the HR clerks and whoever who could come in had to become porters, become messengers to fetch whatever that is needed. The Sunbus, the blood services are on site. They had to relocate to Melpark, which is a problem because now there was no transport. The drivers were not here, and we can't bring anybody.